Hi, my name is Mark Edmiston, and I'm really excited to be able to talk to you today about making strides against breast cancer. Thank you so much for your commitment to the initiative, and I wish I could be in every office talking to you a little bit about why we do Making Strides and where the money goes. I think it's critically important as staff members of the American Cancer Society to understand the critical role that the American Cancer Society has played in the breast cancer story. I think I'd like to start off today by really talking to you about the history, what we've done and where we've been, and then I'll get into kind of what we're currently doing to support the breast cancer initiative across the United States. As the history goes with the American Cancer Society, the American Cancer Society has always been known as the organization of record. When I say the organization of record, it's information that we've done through our research and through others' research that we pull together, and we are the organization of record that lets people and individuals know and insurance companies know what the most appropriate guidelines are when it comes to breast cancer screening or when it comes to any breast cancer information. If you look at the research, our research is always fact-based, it's always scientific-based, and we're responsible for, as an organization, for connecting with the Center for Disease Control, connecting with the National Institutes of Health, and truly working with them to outlay and give out to the public the appropriate published guidelines when it comes to any breast cancer screening. The American Cancer is also responsible for the information behind anyone's educational material. So if a hospital, a local organization, primarily anyone uses the American Cancer Society data in their annual reports, in their breast cancer brochures and pamphlets, when they talk about breast cancer in general, they recite the statistics based on the American Cancer Society and the fact-based information that we provide to the public. Also, as you can imagine, if the American Cancer Society is the organization of record, we're the ones who state the scientific fact base says that this age a woman needs to be screened, and it's most cost-effective. More importantly, it's most important for her health. That then aligns the whole organization, all the insurance companies, then align to support, and then that's what they choose to fund, and that's what they choose to offer to the public and to companies as far as health plans go. So you can imagine the responsibility as an organization that we have whenever we publish information. It impacts so many systems, it's unbelievable. But I want to talk to you about the history then. Now you kind of understand the structure, how things work at the national level, how critical our role at the national level is in the fight against breast cancer, and also how critical our role is at the local level. So I want to talk to you about the path that we've gone down when it comes to the breast cancer story. So if you look at our path, one is we looked at the research that we've done and we looked at the research that others have done, but primarily the American Cancer Society, as one of the leaders in research, first came out with the concept and the support of the concept of breast self-exam. Many years ago, when I started with the American Cancer Society, breast self-exam was all we had. We had breast self-exam that was an individual exam done by an individual, of course, and then we had clinical exam that was done by physicians or nurses in a clinical-based setting. So if you looked at a physical breast self-exam, that's what we had, and that's all we had to work with. There was no mammography, there was no digital mammography, there was no BCRA testing for genetics. It was truly breast self-exam. As a field rep with the American Cancer Society, my job was to actually go out in my communities and to deliver breast self-exam messages. We had models that we used, we had shower cards that we provided to all women that they could put in their shower to remind them once a month to do their breast self-exam. The American Cancer Society put the education, the information, and all efforts for breast cancer into breast self-exam. This was prior to any other organization or anyone else truly focusing on the cause. We also provided information to healthcare professionals. So we're actually the organization that helped them train, provide the certification for their trainings so they could be trained on how to do a clinical breast self-exam for women. If you can imagine, back then breast self-exam was all we had. And you can imagine the size of a tumor that would have to be by the time that you could actually feel it with your hands through a breast self-exam. So that was kind of the concern at the time, is we needed better research. We needed new technology that would get a tumor. Once you caught it by breast self-exam, it was pretty much already past stage 1 and into the later stages because it was so big that it could be felt. The next thing that the American Cancer Society did was do the research that also support the research that led to mammography. So mammography that we're kind of dealing with today, we're more the digital mammography, but this was the older type of mammography was a low-dose radiation image of the breast. So the goal was to really educate first healthcare professionals and educate them on what digital mammography was. And then all of a sudden, across the United States, all of these digital mammography facilities started popping up. Every organization, once we set the guidelines that, wow, this looks like the age that's most appropriate for women to be screened for breast cancer, and digital mammography is 10 times better than breast self-exam, then organizations and institutions started to put together digital mammography facilities. So there were any kind of radiation facility could, of course, most radiation facilities could accomplish and do mammography if they had the correct machinery. So the American Cancer Society did the research behind mammography. We then worked with insurance companies and the public to educate them that this is something that you need to do and it can be done well. And then we also worked with insurance companies to cover it in their plans to make sure that this screening technique was covered in insurance plans. And then once it was solidified, then what we had to do is we had all these mammography facilities starting to do mobile breast self-exam. The mobile units started up. And what happened is people started to go to facilities, and they were not getting a quality mammogram. There was still breast cancer that was found but not caught by mammography. That kind of started the issue with the public saying, we hear you saying we need to get mammography, but in some cases we've seen people get a mammogram and it's not catching the breast cancer that they had. So then the American Cancer Society worked again at the national level to work with the appropriate certification areas to make sure that there was certification criteria appropriate for screening facilities. So they had to go through a certification, they had to make sure that their machines were calibrated correctly, and also we had to work to ensure that the radiation technologists that were working with and doing the mammography on the women were certified and they did things in a certain way, as well as the radiologists reading the screening, make sure that they were certified and really truly looking at the appropriate areas in the mammography. The goal at that time, once mammography came to light, we got it to where we educated the public on it. We were able to get screening facilities certified and make sure that it was quality. Then the next thing we had to address was the cost. The cost for initial mammography was crazy. It was in the neighborhood of $100 to $200, $150 to $200, and the prices kept going up because the demand was so high. And what the American Cancer Society do is we had to truly get in and work with insurance companies, and we had to work with facilities saying there's no way that we can do mass screening for mammography if we cannot get the cost under control. So then the American Cancer Society worked to get the cost under control, and that came down to close to about $60 at the time. So as you can see, the research that we did led to breast self-exam. The additional research that we provided and information we provided then led to the entire outlay of mammography, which included healthcare professionals, the general public, insurance companies, the whole 9 yards. So everything really, all those pieces were supported and funded by the American Cancer Society to make sure that the women in the United States had fair access and also knew what was important, which was annual screening over the age of 40, an annual screening mammography over the age of 40. As you can imagine, what our goal was kind of two-pronged. Once screening mammography was out and going and the facilities were there and they were capable, the next thing we had to do as an organization was kind of focus on two different population groups. One population group, as you can imagine, is going to be what we call the low-hanging fruit. And that's going to be those women who are covered under their insurance to receive an annual screening mammography. That is one of the sole purposes that Making Strides Against Breast Cancer is a corporate-based initiative. It's not a community event. Your event should be very corporate and should look very corporate. The goal of calling into companies, finding someone who has an issue of breast cancer, and then working with them over the course of past the breakfast to the event to build a corporate team is to truly drive awareness in those corporations, raise awareness in those corporations so those women are telling stories and reminding each other, we're covered, let's go get our annual screening mammography. So that is one piece of the population that we're trying to work with, which is what we call the low-hanging fruit. Those who have coverage and just need to be reminded to go get their annual screening mammography. The other part of the population is truly the underserved population. As mammography was coming out and it was kind of costly, it was available to those who had insurance and those who could afford it, we then realized this other segment of the population, a good 30% of the population, didn't have, this population didn't have the resources to get a screening mammography. And even if they got a screening mammography, if they were able to scrape the money together to do that, there was no physician or no institution attached to that was going to take care of them if they had a positive result. So not only is screening important, its follow-up care is critically important. You can't just screen without offering and having available some type of follow-up care for those individuals. How horrible would it be to find out you have something and not had the funds to do anything with it. So as an organization, we have the responsibility of making sure that both pieces were taken care of. One thing that the American Cancer Society did nationally years ago, probably about 1984, was what we called the National, it was actually called ACS National Supportive, it was called the Texas Breast Screening Project. And what the goal of this project was, it was to really try to market to women in underserved areas and also the general population and drive them to call the 1-800 number, one, to educate them on mammography, check with them and their insurance to see if they had insurance, if they were covered, and if they were underserved, which was the biggest part of the marketing campaign. What we did is we worked to organize in Texas 306 facilities that agreed to provide a $50 screening mammography to women that would come in their facility, and they then agreed to provide follow-up care to those women who were tested positive. So through a big organizational structure, all done by the American Cancer Society in cooperation with local hospitals, we organized the Texas Breast Screening Project to see if it's possible to massively screen underserved women or uninsured women. The result of the campaign, over a 3-week period, 109,000 women called the 1-800 number, called the toll-free number, and out of those 109,000, 99,000 were eligible to receive a free screening mammography certificate at one of the 306 facilities. 64,000 of those women ended up going ahead and getting the screening. Out of that 64,000, 214 cancers were found. And that was a good thing. Those cancers were found, and there was follow-up treatment provided by those facilities for those women. But even more so, we had 64,000 people in the state of Texas that had just received their first screening mammography, which was also known as the baseline. I don't know that everyone truly understands. I want to make sure everyone understands how the mammography piece truly works now. That the goal is to get a woman screened at age 40, younger, or talk with their doctor if they have a history, but definitely get what we call just a baseline screening. Screening is not for people who have problems already. Screening is for those individuals who have no symptoms. It's a part of their normal health routine.